Hi doctor friends, welcome to my YouTube channel PG Doctors in Ranju. Today's topic is Microbiology One-Liner Part 4. Before starting with Microbiology One-Liner Part 4, this is very important topic for your revision purpose, nothing else. And so watch this channel till last so that you can't miss one or two questions or more questions. So make it notes and revise it. Let us start without wasting of the time. The dimorphic fungi. First of all, what is the dimorphic fungus? The dimorphic fungus exists in the two form. First, mold form and another is in yeast form. The trick to remember that mold is cold and heat is yeast. Mold is cold and yeast is heat, so that you can easily remember. The dimorphic fungi are Penicillium morniffi, Blastomyces dermatitis, Coccidioides amitis, and Paracoccidioides brasiliensis, Candida albicans, Blastomyces dermatitis, Histoplasma capsulatum, Spirothrix sankey. Next is the malabsorption syndrome. Malabsorption is caused by the causating organism belongs to Giardia, Strongyloids, and Capillaria philippensis. Another question that the gas gangrene. The gas gangrene causating organism is Clostridium histolyticum, Clostridium novi, and Clostridium septicum. These one-liner questions are asked in the previous NEET PG, AIIMS PG, DNV, FMGE. In all examinations, this is mostly asked question. The culture media of the leptospirosis is Corthrop. The leptospirosis, the growth of leptospira in the medium containing either serum or albumin plus polysorbitol, and liquid media containing rabbit serum that are described by Fletcher, Korthoff, Noguchi, and Stewart. So Korthoff word is used for such. And in the current practice, the oleic acid albumin media EMGAH media are used for the leptospirosis. Next, the intermediate host for hydrated disease is men. A 25-year-old male presented with diarrhea for 6 months. On examination, the causating agent was found to be acid fast with 12 micrometer diameter. Agent is Cyclospora. The feature of the Cyclospora that the first is the diarrhea for longer duration, and causating organism was found to be acid fast, and the size are given. These all things belongs to Cyclospora, and acid fast are, you already know, the leprosy, tuberculosis, mycobacterium, nocardia, cyclospora are the acid fast organisms. A man on return from country complained of the pain in abdomen, jaundice, with increased alkaline phosphatase and conjugated hyperbilirubinemia, and USG saw the blockage in the biliary tree. The cause is Clonorchis sinensis, most common organism that block the biliary tree. So jaundice will be happened. Due to jaundice and blockage of biliary tree, the pain in the abdomen is the usual feature. Due to blockage in the biliary tree, the jaundice occurs, and so that alkaline phosphatase also get increased, and in conjugated hyperbilirubinemia occurs due to obstruction in the biliary tree. That is called obstructive jaundice. Next, highest risk of nosocomial infection to patient is in patient admitted for elective surgery. Nosocomial infection, these are most commonly for hospital admitted patient. Congenital toxoplasmosis, truer. The IgA is better than IgM in detection. The diagnosed by detection of IgM in the cord blood. It is the feature of the toxoplasmosis. The biosafety precaution grade 3 is practiced in St. Louis encephalitis virus, Coxiella burnetii, and Mycobacterium tuberculosis. The trick is given for such is MSC. The most common species of Pseudomonas causing intravascular catheter related infection is P. aeruginosa. That means Pseudomonas aeruginosa. The most sensitive diagnostic test for dengue is neutralization test. The neutralization test, also called as the plaque reduction neutralization test, and represent as PRNT. The another test for dengue is the IgG and IgM. These are tests usually done for the dengue. First of all, if the IgM is positive, then for confirmation the this PRNT test, plaque reduction neutralization test, has performed. The another test usually done, that IgM and NS1 antigen assay. This NS1 antigen assay, that means the non-structural protein 1 assay. Next is a gardener. A gardener has multiple vesicles on hand and multiple eruption along the lymphatics. The most common fungus responsible is Sporotrix sankey. The Sporotrix sankey, the first word is used that garner multiple vesicles and hand and multiple eruption and lymphatics are involved. These all are feature of Sporotrix sankey. Due to hand word is used, if foot is here given, then that belongs to Madura mycosis. Next is the RNA virus, or belongs to the RNA virus are Ebola virus, rabies virus, vesiculous stomatitis virus. Regarding prions protein, true is it catalyzed abnormal folding of other protein, which causes Creutzfeldt-Jakob syndrome. Another is true about bacteriophage. It is a virus that infects bacteria. It helps in transduction of the bacteria and it impart toxigenicity to the bacteria. This question gives multiple questions. That means the bacteriophage, what is called, it is transduction process, and bacteriophage indicates virus multiply in the bacteria for the growth and for the capsid formation and toxigenicity. The next question, a girl from Simla with fever, hypotension, malaise, axillary and inguinal lymphadenopathy, culture in the glucose broth, so stalactite growth, most likely organism is Yersinia pestis. True about carbohydrate antigen are it has lower immunogenicity cause polyclonal B cell stimulation does not require stimulation by the T cell. The pertussis toxin. The pertussis toxin or whooping cough toxin acts by the mechanism ADP ribosylation of the protein associated with receptor, increase CMP and acts through G-alpha subunit. True about isotypic variation. The isotypic variation is the changes in heavy and light chain in constant region is responsible for class and subclass of immunoglobulins. True about hybridoma technique or technology are specific antibody producing cells are integrated with myeloma cell and aminopterin, a folate antagonist, inhibit de novo pathway and HGPRTase and thymidylate synthetases are required for salvage pathway. I will upload the hybridoma techniques. So discussed on later video. The nocardia is stained by acid-fast stain, Alessian blue, and mucin stain. The nocardia is a strict aerobe and it is acid fast and also it is catalase positive. And the another media used are BCYE. Here the yeast extract and active charcoal are used. The selective media for Vibrio is TCBS media. Mark the true in the following. Rna virus, the pulmonary syndrome is caused by inhalation of the rodent urine and feces. Causes Rna virus disease or Rna virus pulmonary syndrome. True about Mycoplasma, the sterol enhance growth and can grow in the cell-free media, and when grow in the liquid medium do not produce turbidity. And also the Mycoplasma have no cell wall, so those antibiotic which acts on the cell wall are not acts on the Mycoplasma. True about HUS are not commonly caused by VTEC in the Asia, and recurrence rare and transient thrombocytopenia. True about moat causes decreased efficacy of BCG due to cross immunity. Malta virus caused by Brucella melitensis. True about acute primary amoebic meningoencephalitis is diagnosis is by demonstration of trophozoite in the CSF. The parvovirus B19 causes aplastic anemia in the sickle cell disease and fetal hydrops. True about histoplasmosis. In early stages, it is distinguishable from TB. The true about polio. The polio increased muscular activity leads to increased paralysis. The question arises that the part of Haeckel or full form of Haeckel. It includes Haemophilus, Aphrophilus, Actinomyces comitans, Cardiobacterium hominis, Eikenella corodense, and Kingella kingi. This is also the full form of Haeckel. Okay. Next to that is a 25-year-old sexually active male with burning micturition. On clinical examination, no ulcer in the genital. The urine examination shows 50 WBC per high power field, no RBC. Leukocyte is positive, and gonococci culture are negative. Most likely causating agent is Chlamydia trachomatis. The Chlamydia trachomatis is Chlamydia trachomatis have the feature of bacteria and virus both. The question already arises that the sexually active male and burning micturition. The clinical examination shows no ulcer. If ulcer is present, then the answer goes towards gonococci. But already so here gonococci are negative, and here no RBC and leukocyte strains are positive, and it is the feature of the Chlamydia trachomatis. The scrub typhus is a vector of trombiculid mites. Lancefield classification depends on carbohydrate antigen. The true about Corynebacterium diphtheria has metachromatic granules or metaphosphate granules, does not invade deeper tissue, and toxigenicity demonstrated by ELIC test, and is also cause formation of pseudo membrane. Next is positive sick test indicate susceptible to the diphtheria. The true about respiratory viruses are respiratory syncytial virus, common cause of bronchiolitis in the infant. SSPE is a late complication of measles and parainfluenza. Thanks friends, this is very important. And the SSPE question are many times asked that the late and rare complication of the measles, and it is attached to cell by heme agglutinin. Next, only hepatitis virus which can be cultured is hepatitis A virus, and most common cause of travelers diarrhea already told ETEC. The T word you have to remember for travelers. A child with postural lesion on the leg, on gram staining, gram positive cocci are seen. The diagnosis of group A streptococcal erythroderma can be established by the bacitracin sensitivity test. Pseudo membranous colitis. True are the toxin A responsible for clinical manifestation, and the toxin B is responsible for the clinical manifestation and submit lesion in the early histopathological finding. Most suitable dye for showing fungus in the biopsy is the PAS. The cholera toxin cause continued activation of adenyl cyclase. The anaerobic to aerobic bacteria ratio in the GIT is 1000:1. The patient of acute lymphocytic leukemia with fever and neutropenia develops diarrhea after giving amoxicillin. The most likely organism responsible are the Clostridium difficile. The true about Mycoplasma, smallest prokaryotic organism that can grow in the cell-free culture media, lack cell wall and resistant to beta-lactam drug due to lack of cell wall. The yeast-like morphology is found in the gram stain of lung aspirate in HIV-infected individual. The organism, possibly Candida tropicalis, Cryptococcus neoformans, and the Penicillium murnifi. The cervicitis and mucopurulent cervical discharge was found on examination in a 40-year-old woman presenting with lower abdominal pain and vaginal discharge. Organism best isolated by the culture on the McCoy cell. The pathogenesis of listeriosis is the survival and multiplication of listeria within mononuclear phagocytes and host epithelial cell. Method of isolation of the chlamydia from clinical specimen: the tissue culture using irradiated BHK cell, tissue culture using irradiated McCoy cell, and yolk sac inoculation. This is the microbiology one-liner part 4, and thanks for watching my video. Have a nice day.